Hey everyone, welcome back to my channel. I'm Mike, and today we're talking about something that matters to a lot of Americans living here in the Philippines: healthcare, and more specifically, Medicare. Medicare might actually work here. It's an idea that's been floated, but what if it never happens here? What if Americans retire and have to purchase private insurance or pay out of pocket? Is it really going to cost them substantially more than if they just stayed in the United States? Or will it be a wash when you consider that medical care is at a much lower cost here? Towards the end of this video, I'll be delving into those questions. But before we get this video started, please like this video and subscribe to my channel. My channel is all about practicality and positivity. Also, remember that bell notification. It's a big help as my channel grows. All right, we're going to get right into this video. If you're an American retiree or you're thinking about retiring in the Philippines, chances are you've asked this question at least once. Can I use Medicare in the Philippines yet? And every so often, rumors start floating around social media, expat forums, YouTube comment sections. Somebody hears something from somebody who knows somebody else, and suddenly people are saying, Medicare is coming to the Philippines. Well, as of right now, regular Medicare still does not work abroad, covering Americans receiving routine medical care here in the Philippines. I know, not exactly the answer many people were hoping for, because for years now, a lot of Americans overseas have wondered why they pay into Medicare, sometimes for decades, and then when they move abroad, especially to a country like the Philippines, they basically can't use it for normal health care. And you can understand why people feel frustrated about that. You've got retirees living here in the Philippines, many on fixed incomes, who may have worked for 40 years in the United States, paid Medicare taxes, and are now living thousands of miles away from the healthcare system that they funded. Meanwhile, healthcare in the Philippines can often be dramatically cheaper than healthcare in the United States. So naturally, people ask, why can't Medicare simply work here? Well, under current rules, traditional Medicare, your standard Part A and Part B, generally does not cover routine health care outside of the United States. There are a few narrow exceptions, but they're pretty limited. We're talking about unusual situations like certain emergencies near the U.S. border, or very specific circumstances where a foreign hospital is actually closer than an American one. But if you're sitting in Cebu, Dumaguete, Davao, Manila, or somewhere here in the Visayas, and you go to a Philippine hospital for treatment, regular Medicare usually is not stepping in to pay the bill. And that's where this whole Medicare portability conversation comes in. Because for quite a while now, there's been discussion, lobbying, and advocacy surrounding something people refer to as Medicare portability. The basic idea sounds simple. Allow eligible Americans overseas to use Medicare benefits in approved foreign facilities. And the Philippines frequently comes up in that discussion. Why? Because there's already a large American retiree population here. Medical costs are often lower. Many Filipino healthcare professionals have strong English skills, and the country already has hospitals that attract international patients. So personally, I think it's a good idea to cover retired Americans living here in the Philippines, and here's why I think that way. If medical care costs less here in the Philippines than it does in the United States, couldn't Medicare actually save money by allowing qualified Americans to receive treatment overseas at accredited facilities? That's one argument you'll hear from advocates. And to be fair, on the surface, some people think that sounds logical. But there's an important reality check here. Discussion, lobbying, pilot program proposals, and political interest do not automatically mean Medicare coverage is about to arrive in the Philippines next month. That's where some of the confusion starts, because you'll occasionally see headlines, videos, Facebook posts, or comments suggesting Medicare approval is right around the corner. Then retired expats like myself get excited. Then 6 months later, nothing has changed. And as of right now, there is no broad rollout where Americans in the Philippines can walk into a local hospital, hand over their Medicare card, and receive normal Medicare coverage the same way that they would in Arizona, Florida, or Texas. The system simply does not currently exist. Now, does that mean that the idea is completely dead? Not necessarily. There have been discussions involving concepts like pilot programs, limited testing models, and continued advocacy from groups that want to see some form of overseas Medicare access. But discussions and implementation are two very different things. And if you're planning your retirement around the assumption that Medicare coverage in the Philippines is definitely coming soon, I personally would be very cautious about building your financial future around that assumption, because healthcare planning is too important to base on rumors. So what are Americans in the Philippines actually doing right now? Well, a lot of people are using a mix of strategies. Some retirees maintain Medicare in the United States, even though they can't regularly use it here, because they want to preserve future eligibility if they return to America. Others purchase private international insurance. Some go with local healthcare plans or Philippine HMOs. And plenty of expats simply pay cash for certain services because compared to the US pricing, some procedures and doctor visits here can be relatively affordable. Not always cheap, and not every medical situation is inexpensive. But compared to the American healthcare system, there can be substantial differences. Then there are people who do something else entirely. They live in the Philippines, but they travel back to the United States for major procedures, surgeries, or specialized treatment connected to Medicare coverage. That's a reality for some retirees. Not necessarily convenient, not necessarily ideal, but it does happen. And I think these topics highlight something important about retirement in the Philippines that people sometimes underestimate. Retirement overseas is not just about beaches, lower cost of living, tropical weather, and inexpensive meals. Eventually, healthcare enters the conversation. Maybe not today, maybe not tomorrow, but sooner or later it usually does, and the older you get, the more important this discussion becomes. So is there an update on Medicare coverage in the Philippines? Yes, in the sense that the conversations and advocacy surrounding Medicare portability continue. But if you're asking whether Americans in the Philippines now have broad routine Medicare coverage available here, the answer, at least for now, is no. Could that change someday? Possibly. Governments change policies. Programs evolve. Pilot concepts sometimes gain traction, but until something is officially implemented, approved, and functioning in the real world, I think it's wise for expats to operate based on what exists today and not what might happen tomorrow. Because hope is not a healthcare plan. And if you're an American living in the Philippines, would you like to see Medicare portability become a reality here? Do you think it would help retirees? Do you think it could lower costs? Or do you think that there are challenges that people aren't considering? Now, here's another question that doesn't get talked about enough. If American retirees move to the Philippines and Medicare doesn't really work here and they're paying out of pocket, is it actually costing them that much more? And honestly, the answer might surprise some people. Because if you're comparing Philippine healthcare costs to American healthcare costs, in many cases, it's not necessarily costing them a lot more. Now, before anybody jumps into the comments, I'm not saying healthcare is free in the Philippines. It's not. And I'm definitely not saying serious medical issues can't become expensive, because they absolutely can. But let's talk reality for a minute. In the United States, people can get hit with medical bills that are absolutely staggering. A specialist appointment, diagnostic testing, imaging, outpatient procedures, medications, surgeries, well, the numbers can climb very fast. Meanwhile, many retirees living in the Philippines will tell you that routine medical expenses here can become surprisingly manageable when paid directly out of pocket. Maybe you pay cash for a doctor consultation. Maybe you pay for lab work. Maybe you pay for prescriptions. And while nobody enjoys spending money on healthcare, some expats look at the bill afterwards and think, wait a minute, that's it? Because compared to what they were used to seeing back in America, the price difference can be substantial. But, and this is important, routine healthcare and catastrophic healthcare are not the same thing. That's where retirees need to be careful. A standard doctor visit, one thing. I paid as little as $11. Long-term hospitalization, cancer treatment, major surgery, intensive care, chronic medical conditions requiring ongoing management, now you're playing a different game. Because even in a lower-cost country, major medical events can still produce very serious bills. And that's why some retirees choose not to simply wing it with healthcare planning. Some maintain emergency medical funds. Some purchase insurance. Some keep Medicare active back in the United States in case they eventually return. Others build their retirement budgets around the possibility that healthcare expenses could rise dramatically with age, because there's an uncomfortable reality. A lot of people move overseas focusing on what they'll save on rent, food, utilities, and lifestyle. But healthcare risk can sit quietly in the background for years until suddenly it doesn't anymore. Now, having said that, there are retirees in the Philippines who have been paying out of pocket for routine care for years, and they'll tell you that they've done just fine. They've budgeted for it, they've adjusted, they've compared it to what they faced in America, and for their own personal situation, they feel like the numbers still work. So when people ask, if Medicare doesn't cover me in the Philippines, am I doomed financially? I don't think that's automatically the right conclusion. The better question might be, what kind of healthcare needs am I realistically likely to have? And what is my backup plan if something major happens? Because healthcare planning overseas isn't really about assuming everything will go wrong. It's about understanding the difference between manageable expenses and life-changing expenses. And if you're thinking about retiring in the Philippines, that's a conversation worth having before you pack your bags, not after you're sitting in a hospital and wondering, how am I going to pay the bill? Drop your thoughts down in the comments below. Thanks for watching. Hope you enjoyed this video, and I'll catch you in the next one. God bless and peace out.